Gresham College presents Reducing Inequalities in Child Health, Part 5, Panel Discussion, with Zara Todd, Tabitha Manzuangani, Cyra Mutesi-Kirenho, and Benjamin Farnes.
Right, now we've had a great time up till now, I'm sure you will agree, but this is going to be the highlight of the afternoon, I think, because we've had lots of challenges from people who have been working in this area for a long time, but the question that Helen has posed is why wait for a generation and what can be done now? And we have 4 young people who I'm going to ask to come and take their seats at the front table, please. If you could come along up, that would be great. We've got 4 young people now who are going to offer their insights. Zara is a young disability consultant. Ben is a member of the Youth Parliament. Tabitha arrived in the UK from the Congo and hopes to read law at university. And Cyra is a student at the University of Kent and was also a care leaver. So they've all got very different perspectives to answer that question, why wait for a generation, what can be done now? And what they're going to do is to say what they think has made a difference to them and what they think would make a difference to others. So, Zara, please can I ask you to kick off? Thank you.
Okay, first of all, I have to make a confession. I am not a young person by UK definitions of young people. However, I am still a young person internationally, which makes me feel slightly better. That being said, 80% of my work is around working with young disabled people aged between 11 and 23. So I spend most of my time with young people. I am a disabled person, as you can see, and I've been disabled for as long as I can remember. Unfortunately, inequality is something as a disabled person and as a disabled young person is part of my everyday life. Inequality happens to me on a daily basis across all bases. In fact, I probably have experienced more inequality with access to education, access to transport and the wider issues than health itself. I was thinking about it on my way here this morning and actually I can't get rid of health professionals. They're everywhere, they won't leave me alone. It doesn't matter what age I've been, I've probably met more health professionals than any other type of professional in the course of my life. Interestingly, so for me, access to health services and health inequality in a kind of focused way has never been an issue. The issues around the fact that I am a disabled person and have an impairment have created other inequalities which probably then impact my health. But actually, access to health itself, I probably have better access than anyone else on this panel. What is interesting though, is my access to health services hasn't necessarily been very good for me. For example, I was thinking about inequality in health services, and the thing that struck me the most is actually when you're a disabled young person, you're often treated as if you're much younger than you are, that you're not capable of making decisions, and that you need to defer to adults to make decisions on your behalf. And actually, for interventions to work, be it on whatever issue, you have to have buy-in from the person you're trying to intervene with. In my case, the best example I can think of is when I was 17, I had a health issue which necessitated me going to a doctor that I hadn't met before. I went into the room, because I was 17, I took my mum with me, and the doctor looked at my notes, looked at me, then looked at my mother and went, "What kind of school does she go to?" Now, my mum didn't know what the purpose of that question was, so I answered. The next question was asked at my mother. I answered. This went on for a half-an-hour consultation. I answered every single question, but every single question was posed at my mother because I couldn't have had an opinion about my own life. it didn't really make me want to let him treat me in any way, shape or form. So that is why, for me, the biggest thing that can be done to make things better and to narrow inequality is actually to ensure that disabled young people, but young people in general, are part of whatever solution, intervention you're putting in place is. The thing that I find very sad is, yes, I might be quite old in the spectrum of youth, but I know that that story is not uncommon to the young people I work with. Even as an adult, I still get asked, where's my parent? Because they can't believe that I'm going into medical appointments without having a responsible adult with me, despite the fact that I've got a master's degree and could probably talk. But it's a day-to-day thing that happens everywhere. What I found very, very interesting was in response to Danny's presentation, I think earlier, there was a thing about the inequalities creating disability and how that was a big issue. Actually, I don't have an issue with the fact that I am a disabled person. What I have an issue with is that health and medical processes are constantly used to define what I am able to access and what young disabled people are able to access. So, for example, I run a project with young disabled people because health and medical thinking is so part of how people look at disability. I receive 3 or 4 paragraphs from young people asking if they're disabled enough to take part in something. Intervention and opportunities shouldn't be based on whether you are disabled enough or disadvantaged enough to benefit from them. Actually, it should be open to everyone. What has made the biggest difference to me, more than anything else, in respect to all the services I've used in my life, as I said, I buck the figures. I am employed, I have an education, I am independent. In terms of the figures relating to disabled people and disabled young people, I am a misnomer. Because disabled people are half as less likely to have qualifications, half as less likely to have a job. Certainly independents using public transport, you saw earlier in the presentation, it's not something that's easy. It's in so many aspects, disabled young people and disabled people are excluded from the social opportunities that can overcome inequality. The thing that has made a difference to me is being listened to and being brought into the process and being involved in the decisions and the interventions that have happened in my life. It's helped me overcome and see overcome the barriers and see my value and that I can contribute and there is a worth in doing something. I think the biggest challenges to inequality, regardless of whether you're disabled or a non-disabled young person, are inclusion, so being inclusive of everybody, and thinking about how you include people, rather than setting up a service and then going, oh, but disabled people don't come to this, or oh, but children and young people in care don't come to this. Actually, when you're planning a service, plan it to include anyone and everyone from whatever background. The second thing is seeing the individual rather than what group they fit into, because what works for one individual may not work for another. And if you say, well, you're a disabled young person, therefore you must want to go and feed the ducks. If you're 14, you don't necessarily want to go and feed those ducks. What benefit is that going to do for you? So seeing the individual and supporting the individual to become empowered and relating to that. A lot of what's been discussed today is about how you overcome inequality and how intervention at an early age or intervention in various detached ways can help do that. Actually, it's about empowering somebody so that at the point where you ask them to take control over their life, they're able to do it. It's about access to all. It's not that, oh, you're suddenly 14, therefore you can start being involved in decisions in your life. Actually, in order to make effective decisions and in order to have effective interventions and be able to take control of your life as a young person and as an adult. You need to be starting being involved in decisions from as early a point as you can be. So from when you understand what a decision is, it might not be asking you a big question, but it can start with, what do you want for breakfast? Anyway, thank you.
Thank you. That was fantastic, Zara. So, thing that mattered most to you was being listened to, and I think the message that we would take away in terms of what will work for others is about being included. So that is fantastic. Can we move on now to Ben to give us your perspective? Thank you very much.
Thank you, Andrea. I think first I'd like to add is it's been highly valuable actually sitting in today and listening to the different presentations, as they did cover a range of different inequalities, and I hope that in the next 5 minutes or so I can dip into all of those different transport, education and health and try and think of some kind of solutions to them all. We're being optimistic at the end of the day. No, I think firstly, introduction, I'm part of a member of Youth Parliament. I represent a constituency down in Hampshire, Basingstoke, Eastleigh and Winchester, and I've also done a bit of work with the National Children's Bureau and we've looked at specific areas of health for young people, which is where I've obviously bumped into Helen. But firstly, I want to talk a little bit about public transport and talk about some of the inequalities there. I mean, I was privileged enough to serve on Parliament's first Youth Select Committee, which looked at the issue of public transport, and there we kind of divided up some of the key issues which young people obviously face with public transport, the evidence we received. And it was no surprise, obviously, price, availability, accessibility and even safety of public transport were the key themes which were actually brought up. But if we look at price, I mean, London is running a very effective system, and I think we all said how we wish we maybe lived in London to reap the full benefit of that scheme. But in terms of, you've got to look at why public transport is so important to young people. It's not just simply, getting on a bus and maybe going to the local leisure centre. It's vital for many young people for them to be able to access higher education in the form of college. And if we look, for example, of the loss of education maintenance allowance, I mean, statistics, I don't have them to hand, but I think nearly a fifth of young people who considered going on to higher education actually didn't because of the loss of education maintenance allowance. So I don't think we need to underestimate that issue. I think in terms of the Youth Select Committee and where we're heading, the Department for Transport has issued a support for a bus subsidy scheme that's similar to the rail card, and so hopefully we can use, when our report is published later on in the autumn, we can use that to try and foot the cost of some of the grave pricings within public transport. But also, you've got to look at other issues, and you've got to look at stuff like rural isolation. In my area, there are many young people who simply can't access public transport because there is no public transport, and whether or not that is a result of different bus subsidy cuts, or whether or not there hasn't, it's simply because there wasn't never a bus service in the first place. So I think we've got to work a little bit more to try and resolve some of those problems, especially rurally, as if there has been a loss of service, we need to try to make sure that that there is a partnership between transport companies and local authorities to try and make sure that no young person is rurally isolated. And that brings it to things that I'm trying to do in my local area: set up a local youth board with Hampshire County Council and transport operators with young people, and so they are directly involved in the different decision makings, because it is important to get young people on board. We're not just a group of people who should be bypassed and rubber stamped. It needs to go beyond tokenism. It needs to be young people having full involvement within an organisation and on decisions which affect them. I'm cautious of time, but I think if we dip into education, obviously university tuition fees was raised today, and I don't think we need to argue too long, about what we all think of it. I think everybody's kind of singing off the same hymn sheet with that. But I think one of the biggest concerns for me and for young people I've spoken to is how this will have big effects for social mobility. And I've always stressed that in terms of higher education and universities, it needs to be a place where it recognises academic potential and not simply how big your chequebook is. I've always stressed that, and so I think we need to try and ensure that no young person is excluded or feels excluded. But I also think there needs to be a bit more options available for young people away from university life, because not every young person is suited for university. I don't think university is the be or end all. I think there are many other routes which should be available to young people to go down. And you look at our economy now. A lot of our economy has shifted to a very service administrative sector, and you've lost the kind of the ability to actually get young people on board who have a very good engineering background or actually have vocational skills which they can apply to a job. And we've lost that, and I think maybe apprenticeships is kind of the answer, but I think it's I know money is short at the moment. We've all been talking about money, but like we've heard in presentations earlier, there's not a lack of resources, and we need to try and maximise the resources we do have. Those 1 million young people who are are completely cut off from society. We need to be doing a lot more to make sure that they are engaged in society and actually have a positive future. I'm just going to make one final point, moving on to health, because I am conscious of time. And in my local area, I'm a governor on our local foundation trust. And one of the big changes which has come in has been the commissioning of different services out to the voluntary and private sector, and particularly youth services, where budgets have been cut in up to 50% in particular cases. It's very, very hard trying to strike the right balance, making sure that those young people still receive the same standard of care, particularly when they fall into the vulnerable category or they have specific needs which need to be addressed. And I think that one of the things which did alarm me, particularly when these changes were announced, was that there was a lack of a measure of standard, because why should a young person who lives in a particular area, who maybe has a mental illness or maybe has problems with alcohol or drug abuse or is a care leaver or all the other different scenarios, why should they receive a better standard of provision which is delivered by a voluntary organisation, whereas 5 miles down the road in a different area you'll receive a completely different type of service. So I think that is my 3 points. I'm not going to dwell too much, because I know I'm conscious of time, so thank you.
Thank you very much. And I think a particular thanks, Ben, for reminding us that London isn't the be-all and end-all of life, although we might, those of us who live here might be forgiven for thinking that. But that point around rural isolation is, and the impact that has on young people, I think, is very significant and is something that we need to think about. And I'm so glad you were a governor on a foundation trust. That is fantastic, because I think it goes absolutely to what Zara was saying earlier, which is involve us and listen to us. And so I'm so glad that you're able to do that. Moving swiftly on now to Tabitha.
Hello everyone, I'm Tabitha, and I was involved in the on the buses project, which Mrs. Julie nicely talked about. My project was studying how the effect of public buses, having free public buses, on the mental health of children. And the results ultimately show that if you allow free access to public transport for everyone in society, especially young ones, it will reduce the feelings of inequality and therefore making them feel more equal in society. I think that is a very important thing in society to think about, because if people, however good or equally we may think they are treated, if they do not feel they are treated equally and they don't feel they are treated or given any worth in society, they may lead to riots, to discriminations, to feelings of anger, which will just make society not a good place to live in. And I really liked the message of the practicality of things, talking about what works. So in society, we want to know what works to reduce inequality in health. And I like the idea of having public transport so that children from different backgrounds can access education and also can access leisure centers and different things. And I just wanted to say about something which I think is very important to me because it made a difference to me. It's education. I think it's very important to help people in different ways in counseling and in other parts. But I think if a person is helped in that way, they're told that they can do something, that they are good at something. But if in the material part of life, the state are still the same, they don't have jobs and they're not educated, they don't know how to look after their children, it's still not going to reduce the gap between the rich and the poor in terms of health. And the problems of education or inequality in health is not just the fault of the rich people. It may also be to do something to do with lack of education of people from lower backgrounds, because they do not know how to look after their children, and or they do not know how to look after themselves, and things like that. And this leads me to 2 points. After having the practical bit of helping people to go to education, or by having the transport and also having access to leisure centers, sometimes people who may be disabled in education, not in education, but in different ways of accessing education, they may not be able to thrive or to succeed, not because they don't have the education, they can go to school, but because of the way they may not be so fast in learning, or they may not be very intelligent. And if we don't have charities who are supporting those children to succeed in the education, I think it may not work just having the one practical bit of accessing education. This is something which is very personal to me, because I've been given a scholarship to a private school, and I did really well in a state school. And going to a private school, I worked really, really hard, but the way of accessing education, it didn't work properly because of the way my brain works. I'm an independent learner. I learn things by myself. And so going to a private school, it means that I have to be taught everything. And my brain wasn't absorbing that. And I came to a point of thinking, oh, am I dyslexic or something? And if I was left just to think, oh, you can't do it, then no one would be there to help me. And I think having charities which help people to do well, or to help them educationally, to boost their confidence, it's very important. And one such charity is Clever's Corner, where I volunteer in, where people, young children, they get educational help, they get social help, boosting their confidence, and also leisure activities. And the second point I wanted to make is that sometimes not everyone have the willpower or the strength to, when they have the education, they have the access to education, to do well. Sometimes we face problems, and some people may become pregnant, not because they want to, but maybe because they didn't have self-control in society, of the ability to control themselves. They go pregnant, or they ended up in prison. And so what can we do about those people? And I think every society, everyone faces problems. And I think the difference between those people who succeed and those who do not is in the way they deal with the problem. And I think it's very important to have other charities which are in a sort of outreaching those people, not to make them feel lower. Because if those people who were teenage mothers and who went from prison and they come to society, they feel excluded, then their children are more liable of following the same path, or of having cases such as baby P, where mothers may not have the educational help. I'm not going to deep dwell on that, but I'm just going to say that children may not be able to have parents who will be able to look after them properly. And I think if teenage mothers or people who coming out of prisons have other charities which is helping them to to know that they can access education, they can still be lifted up, that they can be, their confidence can be boosted up. They are someone in society is very important. And this brings me to the point of the big society. And I think David Cameron is a good person to think of the big society, of trying to think of what is the most loving thing to do in society. That's the reason why we are all here. We want to reduce inequality. We want to do what's the most loving thing to do in society. And I think it's sometimes theoretically good to think that, oh, big society, everyone will be helping each other in communities, will be having charitable things, but the fact is, the practical thing is that not everyone are like that. In the sense, they want to help society, they want to do things for free for the library, they want to volunteer. It's not very practical, because if a person doesn't have a job, how can they volunteer to help? And I think it's important for the government to think of funding charities which are mainly there to help things like that, running libraries and things like that. And I hope I was clear in what I wanted to say. Thank you for listening.
I think you were fantastically clear, Tabitha, and I think that, you know, the messages that I and hopefully others would take away from that is the absolute importance of education. I mean, you know, clearly a huge impact, and I just loved the way that you talked about the things that people want to do, the most loving thing to do, and that was a lovely phrase, and is one of the ones that I'm definitely going to take away from this afternoon. So last but certainly not least is Cyra, who is going to give us her final perspectives. Thank you.
Hi everyone, my name is Cyra. I'm a care leaver and I'm currently studying English and History at the University of Kent. When Helen sent me the questions to answer today, I started referring to my sociology A-level books. Like I was just lost, I didn't know how to answer it, so I thought the best way to answer it was to probably use some sort of, probably use some sort of personal experience. So I went into care at the age of 12. Prior to coming into care, I was from a working class background. My mother and father both were not professionals. So I went into care and I was introduced to a middle class family, which introduced me to a different, I don't want to say better, but a different quality of life. Which in turn helped me in terms of education, health, housing, so on and so forth. I wanted to say, in order to ensure the best health for children, in an ideal sense, all sectors of society should endeavour to be in an elite condition. However, as we are not in a health utopia yet, we must equip children and young people with the right tools of knowledge in striving towards a level playing field. This, I believe, should come in forms of education and various opportunities. Opportunities is something that's really close to me, because not so long ago I became involved with the National Institute for Health and Clinical Excellence, NICE. And while sitting on that, I was introduced to a different type of life. I was meeting with professionals, and this was not something that I was used to prior to this. So that's why opportunities and education is really important to me. Not only this, but I'm also involved with the health and social degree at the University of Greenwich on a postgraduate as well as undergraduate level. This entails interviewing students as well as interviewing prospective students, as well as visiting lectures and saying a little bit about my experiences in care. Through this, working with the University of Greenwich, I've been able to build a relationship with the university, which has also led me to other opportunities such as joining foster panels, so on and so forth. So, to put it in a nutshell, what I'm trying to say is that I think to bridge the gap and to better, to improve everything, I think it revolves around access. access to a better everything, basically. I think that would make the difference in others, because that made a very big difference for me, and that's the main thing that I can go off, I guess. Access to more opportunities, just access to a better everything, really. Like, I can't stress it, just access. Access is what I think is the most important thing. I'm not going to repeat it again, but you know what I think it is. Thank you very much. Thank you.
So what did we all think that Cyra thought was really important? I think it was access. Yes, we got that. That's great, and clearly you and I have common bond, because I did history at university as well. So yeah, great degree. I think we've heard some fantastic insights from our young people today, and although they all said it in slightly different ways, I think that there are some very common themes that came through that, which is that involving young people in what we're doing and how we're trying to do it is just so important, and giving them that access to have those opportunities. So I think, for example, the fact that Cyra was involved in the University of Greenwich and actually interviewing prospective students and taking part in lectures is just great in terms of making sure that the professionals of tomorrow are also thinking about this. So we have about 25 minutes for any questions that you would like to ask any of our wonderful young people here, or any comments or observations on some of the things that you've heard this afternoon. There is a hand straight up in the air at the back there. Thank you.
Thank you very much. That was absolutely inspirational. Could you please tell me how to involve more young people like you in foundation trusts and patient forum and patient participation groups, please, in health?
Okay, thank you. So I think we'll ask Ben that first, as he actually is a governor in a foundation trust. So what might be really interesting is to find out how come you ended up doing that, and what you think it might, what we think we might be able to do to get other people involved. And then I'll see if other members of the panel would like to say anything as well. Does that sound okay?
That's fine. Yeah. I suppose, well, from my own personal experience, it was because I was involved in the Youth Parliament, and the opportunity came through Hampshire County Council. It wasn't like a direct, like, open application, as it were. I suppose one of the main things to remember, and this is a universal point, is that young people do want to be involved. No matter how much they try and hide it or shrug their shoulders or maybe say, no, I'm not going to be involved, young people do want to be involved, and I think it's brilliant to ask the question how they can get involved specifically on foundation trusts. I think from my own personal experience, I think it needs to be, you need to get a quite a delicate mix, and from my own role on there, down in Hampshire hospitals, I think you need to get the mix of people who have actually been received health care and who actually have been involved in the health service, and so maybe, you know, to get some kind of former patients or people who actually have experienced it. But I think it's also vital that you actually get young people on board which maybe haven't had an involvement. And of course, probably the hardest question is, how do you get those young people? It's a variety of ways. I mean, you can go down the traditional route of trying to get like big organisations on board, so either like the Youth Parliament or, you know, different forums. But I think one of the best things is just get young people off the ground. You know, the ordinary young person on the street who maybe doesn't have much experience in, you know, in talking to decision makers, as it were, and you know, just try to work through colleges. I know that, I don't know, in my area you've got a thing called Local Children's Partnerships, which is a collection of different bodies of schools, of hospitals, of social services, of a range of different things. And there you can hopefully try and get a diverse set of young people, not from a particular background or area or, you know, age or gender. So I think, I mean, especially, I know schools and colleges will want to be on board. I think that going through them, as well as going through other youth organisations, is a great way of trying to get a diverse bunch of young people.
Could I maybe ask Zara, seeing as how you said that you'd seen more health professionals in your life than anybody else, any particular comments from you in terms of getting involved?
The only thing I was going to say is information is power. And actually, if you ask the average young person on the street if they knew what a health board was, or if they know what the Strategic Health Authority is, or if they know what any of those organisations are, they go, what? Because basically, unless you're in the system, how do you know about the system? So actually, the best way to get young people involved is to tell them that you exist, because structures like that are very well hidden within a lot of bureaucracy. And the reason why it's the constant complainers or the professionals that sit on every board that ever existed that appear on those boards are because they know those boards exist. So the biggest thing you can do is tell more people that you exist.
That is just brilliant. And actually, I think that goes for the entire general public. You're absolutely right. Was it Tabitha who was wanting to come in there as well?
No, it's fine. I just wanted to clap. It's really good.
Are you okay then? Okay, well, we have another question at the back, and then I will come down to the front. Yes.
Thank you very much for giving us all your perspectives. And I just wanted to touch on your question. As a health professional who's realised that, as you said, Zara, so eloquently, information is power, we've started using co-production to try and improve the well-being of young people. So we're actually working with our young service users as a resource, as co-partners in redesigning health services and around what their needs are, and trying to work in sort of mutual reciprocity in seeing in harnessing their assets and resources in order to improve the services that they are, we're designing for them.
Could you just let us in on the example of good practice and tell us where you're doing that?
So I mean, for us as a sort of very paternalistic profession, it's quite a mindset change, and yet so much more powerful to bring about a change that's effective, that's going to last, that's going to be meaningful. So, for example, we work with young people, adolescents with long-term conditions. And Zara, all the things you've said are so utterly, utterly true. How do you expect a young person to suddenly become independent unless you've been involving them much early on? So we've worked with a group of young people with long-term conditions, and the kind of ideas we've co-designed are things like information apps, so using mobile phone technology to empower that young person from a really young age, as you said, Zara, from 9, 12, to have an app which both gives them information about their condition, which many didn't have because they've grown up with it, in order that they can make informed decisions about lifestyle, and also a care plan app. So they're holding the information about their condition instead of being a sort of passive recipient, or worse than passive, someone who's just talked over at touch points with either education or professionals. So we've been working, so this idea of co-production, I think, is much more powerful than just your opinion or being involved or a token member of the board. It's about using the young person to co-design solutions with you.
Thank you very, very much. And just to add from our own experience at the Social Care Institute for Excellence, we worked with NICE on a guideline around looked after children, and then have turned that into a website which is called Info for Care Kids. And one of the things that we did was absolutely what you said, kind of involved young people in the design, which totally revolutionised what it looked like. And because, quite frankly, they were not backward in coming forwards with their views of the clunky old design that we'd already thought up. So it is a very, very positive way of moving things forward, I agree. Can I bring the microphone down to this lady here, and then...
Thank you. I'd like to know what you think about this. The media at the moment has been trying to set, I think, the young against the old. And admittedly, in my generation, we did benefit from a lot of support. I myself had got a lot of help with my education. Even though my father had died, I still went to training college and whatever, and got a lot of support. And also I benefited from rationing and having fewer sweets. But how do you feel about this? And do you think that the old and the young can work together?
Oh, that's a great question. I'm going to go to our middle people in the panel, because we asked Zara and Ben to answer the first question. So, Cyra, would you like to kind of kick off on that in terms of can the old and the young work together?
Of course. That's not even a question. Like, I just don't feel, I feel that there's a wedge between the old and the young because there isn't enough forums that include both the young and the old. Of course, definitely. Like, at home, my grandma is the person that I would go to the most. Do you see what, like, I would go to my grandmother over my mother with certain problems, so definitely. And there's a lot that I could learn. And that's just on a personal note, so if we're talking society, definitely. Yeah, definitely.
Great. That gives us hope. Tabitha?
I think it's very possible for young and old elderly people to work together. I think the barrier may be due to prejudice, not that one that is set by any of the different groups, elderly and the young people. The media may be playing a part in it, and I think that may unconsciously affect the way older people and young people think. For the elderly, they have fear of associating themselves with the younger people. And the younger people, I'm a young person. Normally, when I talk to my friends, they think that because they are expected to be like that, that's how they have no control, so they will behave like that. And that is something which is really sad, and it comes to my thinking of, because I like to think a lot about how if a person, they feel and think badly about themselves, they have nothing to offer of good because they hate themselves. And I think that's something really quite far too-fetched, but it's something to do with that. And I think we can work to get together. And I was involved in the care home. I worked there for a while, and I think there's a lack of young people volunteering, and the idea of the big society can be put more into action if the government can help younger people by making them feel important, say encouraging them to work in those charities. But also I think it's important for those young people to have some kind of funding, because the world is not made of loving, pure-hearted people, because we want to help, but sometimes if there's no funding there, it's quite hard to do so.
Thank you very, very much. I love that idea of encouraging younger people to be volunteering. Ben, did you want to come in on this one as well? I
mean, firstly, I think never trust the media, because obviously, I think there is been a huge wedge which has been kind of picked up by the media and kind of is ridiculous, because you have the stereotypes of what a young person is and what an old person is, and it kind of gets seeped into people's thoughts. But I think absolutely, I think young people and the old people, I think in many ways are very similar. We're both very reliant on public transport, for example. We're both in different. When you're young, or if you're on the other side of life, you are considered as maybe vulnerable. You are the most vulnerable groups in society, and I think I've seen evidence when young and the old actually come together on a combined issue and work together. It's wonderful, because not only do you get the respect that an older person would, obviously, you also get the freshness and the ideas and of that from maybe from the young person. So I think the two combined together is a match made in heaven.
Oh, isn't that great? Thank you very much. And this lady on the edge there.
Thank you. I wanted to thank everybody here as well for this afternoon, because I find it really inspiring and very insightful as well. So that's given me a lot of encouragement to really try and go back and do something about health inequalities, obviously not on my own. But I wanted to sort of ask a question to the panel on what their thoughts are, really for young people who don't have access to all the opportunities that you were talking about and that you've experienced on the panel as well. And some of the inaccessibility and difficulties for opportunities for some young people is because they live in an environment where their parents and their teachers and their peers all say that they're not going to amount to anything, where their self-esteem can be quite low and belief in themselves can be quite low as well. And I think they're the very difficult people to engage and access, to find out what can help them. Sometimes parents are a barrier to that as well, because they wouldn't want to accept that their they're not parenting in the best way possible. But for those very young people who don't have those opportunities and access, they very often live in areas of high deprivation with low socioeconomic status and don't really have any aspirations in life at all.
Thank you very much. Zara is wanted to come straight on in there.
Yeah. I was told at the age of 11 that I wouldn't get a GCSE. Admittedly, that's a lot to do with the stereotypes and perceptions around disability. I think I'm lucky in that I haven't experienced the barriers that you just outlined, but I think there is something very, very at the core of that, and that is a lot of what has been kind of talked about is about us going into education or us being put in a position where we can go to an opportunity. And actually, maybe the solution in part to what you proposed is that opportunities need to go to people, not the other way around. Mm-hmm. And actually, at the moment, if you look at every single member of this panel, regardless of what background we've come from, we clearly have, through some part of our upbringing, developed resilience and a drive to go and find something. So maybe one of the things that needs to be helped for all young people is to develop a resilience and a sense of self-worth and self-identity that can withstand the barrage of criticism and disadvantage that they face. But also, we have all, from what I've heard this afternoon, gone out and sought opportunities. And actually, the group of people you're talking about are not, because of all the reasons you've mentioned, are not going to go and seek those opportunities. But actually, that then comes down to providers, be it health, be it education, or whatever, to go and offer those opportunities in places that are where those young people are, but also to show value to young people in taking up those opportunities, because a lot of the opportunities that we've benefited from and that have enabled us to develop, to be sat in a room and answering your questions, have been done in our voluntary time with very little recognition other than, oh, you've done a good job. And actually, this is very crude, but money talks and money shows value, and you're being employed to do a job. Why do you think that young people should want to get involved in something that potentially could be quite boring without having some kind of acknowledgement of this is valuable, we see the value in that, so we'll give you money. I'm not talking about lots and lots of money. £20 to a kid that doesn't have very much at all is a great motivator to take part in something.
Fantastic, thank you very, very much. Can I just check, Tabitha or Cyra, is there anything that you want to say on this one?
I absolutely agree with everything she said. Because I myself was told that I wasn't going to get any A's in GCSEs, and I go 10 A stars, not because just of my willpower, but also because there were some people there to help me. And I think it's very important to have working people who help to boost people who may not have the advantage to do things easily, may have disadvantages. And I think there's not much more to add to what she just said. I agree to it.
Thank you very much. Cyra?
I'm just going to echo everything. But no, similarly, I was told that I'd only get, well, it was half a GCSE. Because it was a short course, so it translated into half a GCSE. And yeah, I did all right. But that was because I had people around me to help. And that's also because I just didn't want to be a statistic. But I think this is something that we need to feed towards other young people who are in similar situations.
Thank you very much. And Ben?
Well, I think that's a very, very important question, and I think you could open a whole can of worms on that, on what we could do on a national basis to try and tackle that. But I think, from personal experience, I know that as a member of Youth Parliament, one of the things which I'm very conscious about is getting out there and talking and involving young people who maybe don't get heard, who do keep getting missed off at, or, missed out, as it were. And that's one of the hardest challenges, which we face is reaching out to these young people and saying to them, look, you're not excluded. We don't want you to be excluded. We want you on board. We want you involved. And I think I referred a little bit to the youth board I was trying to establish in Hampshire. That is an example of getting out there amongst different youth services, amongst different specialist needs within schools, and saying to the young people there, get on board, you are wanted, you are heard. And I suppose it does partially come through education, because that self-worth, that self-belonging, it also comes from at home. And I think if you do come from a household which parents don't put that level of emphasis on, achieving in life, and you have got low self-esteem, obviously you're going to be knocked back before you've even started. But it's about saying to those young people, look, come on board, we want you involved, you are just as valued as anybody else, and making everybody feel equal and valued. And I think that's probably the most important aspect of it all.
Thank you very much, thank you. Gentleman here, thank you. I think you might be the last one with a mic, so make the most of it.
You might think this is a facetious question. Supposing I was a spectacularly incompetent government minister, and
was that competent or incompetent? Incompetent. Just checking.
And I came along here and said, I've realised we've got some spare money. It's a bit embarrassing. Could be quite a lot of money. I'm not sure how much it is because I'm incompetent. But it's all got to be spent by next April, by the end of the financial year. What one thing would each of you spend money on to improve the position of disadvantaged young people?
Whoa, that's a cracking question to end off the panel with. Right, so do we start at the top or the middle or the bottom? So what one thing, Zara?
This is very particular to why I'm sat in front of you. Actually, for disabled young people, the one thing that could be done to overcome a lot of the barriers that young disabled people face is actually training for professionals, training around the social model of a disability, and training for basically the adults that work with young disabled people to have aspirations for their young people, to translate those aspirations in a positive way and to be empowering. Because if you're constantly surrounded by adults that feel that they need to make decisions on your behalf, or that they have very strict ideas about what disabled people can achieve, then that's going to limit you. Because at the end of the day, unfortunately, where we are at the moment in society, disabled young people are particularly dependent on the adults around them that support them in order to overcome any barrier. And actually, the more training and support that's given to adults so that they understand rights, they understand empowerment, and they understand the social model of disability, the more it will have an effect on the largest number of disabled children, because it will last for a lot longer than working with an individual child.
And also last a lot longer than the end of the financial year. So a very good answer, thank you. Shall we move down to Tabitha next?
Oh, thank you. I haven't had a long time to think about it, but I think it is a question of thinking of the future now. Because if you have been incompetent for a while, we want to invest now so that the future is good. And we can do that by investing in young people. Let it be disabled young people, people who came out of prison, or people who are in education. And so how can we invest in in those young people? And I think one of the most important things we can invest in is education. How? Do we put more money in schools? Not necessarily. We can put money in charities which help younger people to access, as she said, emphasis on access, education. If they are disabled, how can they access education if they don't understand things in school, if they cannot travel to school, which charities can help them, which kind of people who are devoted in going to their home if they can't travel. And the idea of reducing inequality is not just for young people, and because we want to think of the future, we want to use young people to the best of their abilities, but also we have to bear in mind that inequalities doesn't just deal with young people, it also deals with the elderlies. It's a question of how can we use these young people in educating them to make them of any use for the elderly and people of different age groups. How can we inspire them? And I think it's absolutely important to really inspire young people, to telling them that you can do this. You can do this in education. You can be good. Even if you've been bad, you've gone to prison, you can help an elderly person. And that is something very important to be a benefit for the future and for the people of different ages.
Thank you very much. Cyra, how are you going to spend this lovely pot of money?
Youth clubs. Youth clubs or youth projects. Because when I was younger, there was like a local youth club, and we were all like an extended family to each other. And that continued even after the youth club shut down. Because you'd want something with longevity, you know, like something that will continue even after it ceases to exist. So I would say youth clubs, something that's open to anyone, whether they be disabled, LGBT, I don't know, like something that's just open for all. So I would say youth clubs.
That sounds like a good answer to me. And Ben, you have the final word.
Well, I'm not used to making choices, especially not on large pots of money. No, depends if you're a government minister prepared to do another U-turn, because in that case I'd ask you to do a U-turn over tuition fees. But that issue aside, I think in today's climate, I think if we had a big pot of money to spend on young people, firstly, you've got to do something about those 1 million young people unemployed. You've got to do something about the needs, and whether or not you invest that money in a national scheme where those young people are presented with different pathways to go off and learn valuable skills which they can progress on into a particular industry or a particular field. I think that is absolutely vital. But also, I think what I was saying on earlier about the rail card, that being similar on buses, whether or not there could be a bus card used on buses in England, whether Scotland and Wales might all devolved anyway, transport is a devolved issue, but in England, introducing some kind of national bus card which is similar to the rail card, I think that would be money well spent as well.
I think we had some great ideas there. I hope you've got a direct line to some incompetent minister. Well, can you just join me all, please, in thanking our fabulous panel.
For all information, please visit www.gresham.ac.uk.